Namaskar. Good morning, everyone. And first, I would like to say a big thank you to Dr. Guru for organizing this because nursing is the forefront of healthcare, the heart of healthcare. And next, I would like to give a big thank you to all the nurses, not only here, outside, wherever they are. We've just come out of a one in a century pandemic. And I think so. The reason India fared well is because of all of you. So, clap for yourself. And one of the things that is then, we are together. I'll say something which I generally don't share, but since you all have called me, it's see on August gathering here. I became a doctor because of the nurses. So you'll be wondering, why is this old man saying that I became a doctor because of nurses? I was in school. My father was an engineer, and we had the senior chemist thing. So in class, after class 9, we had to decide to take arts or science. And my role model was my brother-in-law, who was a bureaucrat. He was an IS officer. Then he retired as the chairman of UPSC. So he was my role model. And in school, it was very strange. I used to get highest in history, geography, and maths and chemistry. So while going on vacation, I decided that I'll take arts and then go and appear for civil service after I finish. And that winter vacation, my father had a peptic ulcer surgery. It was done at CMC Vellore. I still remember it was on 12th of January 1968. If anyone is from CMC Vellore, they'll know Dr. LBM Joseph, who was the professor of retired as the head of surgery there. He operated. And post surgery, my father was in a single room, and I was sitting there with my mother, and suddenly I saw the saline was about to finish. There's only this much left. 68 means I was hardly not even, I was just barely, not even 14 also. And I panicked. I thought, yeah, maybe hawa ghus gaya, my father gone. So that typical Hindi movie thing. I went running to the nursing station. Sister. So what happened? My air is going to go in. My father will. So then they cool down. They looked at the watch and they said, there's still another 5 minutes, we'll come. They came within 2 minutes. They changed the bottle after it finished, before it finished. And so I was, out of curiosity, young, I told, how did you say that there's still 5 minutes left? So then they told me that each drop comes this. So that sort of, what I'm saying is that made me curious. And then I saw the empathy. I'm coming to the empathy. It was told in the morning meeting also. I think so. Nurses, they have no one else, I think so, in healthcare or in any profession, walks the talk as far as empathy is concerned. So when I saw that, suddenly my thought process changed. I think so, go for medicine. So I came back. I joined school late because my father was there, so school had started, and our school was run by the British Council. So we had an English gentleman called Frank Wells. He was a Britisher. I went to his office. You have to sign to take arts or science. So Bishnu, so you're taking arts? No, sir, I'm taking science. What happened during just on the vacation? I told my father had a surgery, and then I saw CMC Vellore, the way things are. I think I should become a doctor. So I told him that's a good choice because you can always change over to arts later, but once you take arts, you can't change over. So that's why I say that I'm here together. I'm standing in front of you because of all of you. So that's why I start off. I think so. I always remember this, that if that encounter would have happened, that engagement would have happened, probably I would have been a retired civil servant by now. So this is what I say, that I think so. I've been fortunate there. I did my medicine from the land of Jagannath, Orissa. Came to Delhi, did my PG here. Then I did, that time there was no DM, so I did my postdoctoral training in God's own country, from where many of you all are there, from Kerala, in Sichitra. And then for 10 years I was a lecturer in the medical college. and then I went to New Zealand, came back, and I've been fortunate to involved in all the three when Indraprasth started, Fortis started, and Max started. So one of the things which I would like to say is that in all the places, I was very clear that if we have to perform well as a clinician, because 70% of my work is in the ICU, 30% in the OT, being cardiac and neuro anesthetics in critical care. So I realized this, that you have to hold the hands and engage them and train them, retrain them, show them. And a lot of times in life, this is something I would like to put across to all the seniors also here. We give an order that ye karo, do this. That why is not explained. Please explain the why. Kyun karna hai? Because when the why is explained to them, it is there in the memory, they will do it. Because as they say, the eye sees what the mind knows. It's a very a process have taught us that from medical school. So it's a very important thing. So I think so, and we being in the corporate sector, there is an issue that we don't get the nurses from the top end institutes. So be it. But five fingers are not same. So when they come, I think this is where the starting point is there. That I'm again speaking from the experience of all my last 30, 35, 40 years, is that hold their hands and see that you train them on the what to do, why it is being done, the processes. So see that the processes are properly understood. If the processes are followed properly, outcomes will be good. Generally, there will be strains and so I think this is a very important part. So I think so one of the things that before we put our nursing workforce on the shop floor, on the bedside, on the OTs and the ICUs, I think so please spend some time. I leave it to organizations how long you can do that. That's a very important part. Don't miss the bus here. If you just you join and after the HR formalities over, you put them on the bedside, we are asking for failure. And that is very demoralizing to the nursing staff. So the HR colleague is there. So I think so this is something that we must focus on. Is that the training before they are onboarded on the bedside, because bedside nursing care is the core of healthcare. So I think this is something that we have to be cognizant about, and this should be no quarters should be left unturned that will be shortening the training. If you do this, this is investment for a lifetime. And when you are appointing them and before you position them in the respective areas, wherever they are, so you know it is this ward, that this ICU, whatever it is. So please, sort of, it's not 100% possible, but ensure that we sort of someone's going to the cardiology ward, at least the basic things of how to handle a cardiology patient. If someone is going to a surgical, these things have to be sort of, and then the most important thing is there. The first couple of months, the hand holding is important. Someone senior to them should do the hand holding, and I think so. This is that what I'm saying is I'm walking the talk as far as I'm concerned. It's not talking the talk. Wherever we have worked, is that this is something that we really enforce. That train them before they are onboarded, and initial phase we must handhold them for some time. If that is there, the nursing care at the bedside will be good. The other thing is that, as was spoken early in the morning, is that none of us are perfect. I'm not perfect. No one is perfect. But we should always have an open mindset of how do we improve. So this is where the nurses, because they spend about 80-85% of more touch point with the patient, they see the entire flow, what's happening. So if there is something not right, this is the empowerment that I'm talking about, is that we must empower our nurses to speak up. And the seniors, right from the chief of nursing of the hospitals down below them, they should sort of give comfort to the team leaders or whatever we call it, to see that at the floor nurses who are there, if they see something's not right, they speak up, because they are at the bedside of the patient round the clock. No doctor is there. Doctor spends hardly 10-15% of the time with the patient. So I think this is something that on a regular basis, if you do, bedside nursing care will improve. Other thing which came up is again incident reporting. this is something that we must be very particular about. There will be issues which will come in, but when it comes in, have the try to have an analysis, what we call the root cause, and find out what are the issues that happen. Correct them and explain to them this has happened. There should be nothing harsh told to anyone. But these learnings, if you imbibe them, you are automatically raising the bar. I'll give you a small example. Medication error, even in USA, is a major issue. Within our organization, we also had. So when we did it, Captain Sandhya is here, as many of our nursing leaders are here also. What we found was that it was basic. Some of you think that this is a silly thing I'm speaking. When the medications were given to the patient, a lot of times the patient file was not with the science. They used to just see from the nursing station and get it. And it is this observation came from the nursing leaders, not from me. We said to look at what are the gaps that we think are there. So put the thought into them that tell us how to improve. Solutions will come from us. Problems are there, we have to get solutions. God helps only those who help themselves. So they came out that, so I think one thing is missing is that the files are sometimes many times are not taken. So we made it mandatory that every medication that is given, the patient file has to be there. They look at the patient file, see that what was prescribed, this is the right drug, right dose, right route. And believe it, medication errors have come very low over the last couple of years. And as I'm speaking, we are preparing a quality report for the organization. We're presenting it to the board later this month after the seat. I'll put it on public domain. I'll share a copy with you, sir, after it is after the board sees. If you look at it, all the things that are there for quality have been captured. We look at it on a regular basis. So this is where I'm coming to, is that you're discussing about quality. All the things that, whether it is COTI, CLAPSI, patient fall, your hospital-associated pressure ulcers, they will happen. But review each and every. When you review that, you will find some things which you can correct. Those learnings need to be captured, need to be shared. That is how you keep on improving. Healthcare has evolved over time, and I think this is something very important. Now, critical areas, for example, the OTs. Again, a lot of times you see the surgeons don't scrub up properly and they quickly rush. So I think this is where the nurse in charge of the OT or I'll leave it to how you do it. They must be firm on this. I remember as a junior when I was training in New Zealand, the nurse in charge of that OT, he told, Doc, I think so. This is not the right way to the way you're scrubbing. And believe it, from that day, I've never faltered. She taught me the way to wear a gloves without touching the gloves, which wherever I worked, I've trained all of them. You don't have to touch the gloves. With a gown, if you keep your gown like this here and wear it, you will not touch the gloves. So simple things. So what I say that, why I'm saying this, because nurses, if you empower them, you listen to them, it's आपके हित में है, patient का हित में है. Because this is one sort of a vertical in healthcare where we talk about patient-centric, patient-centric. But I think so it is nurse-centric. If you have to look at good healthcare, you have to be nurse-centric. So all your quality parameters that I don't want to get into the details of that, please look at it on a regular basis, whatever, and keep reviewing that. And on a monthly basis, the medical head, the nursing head, the quality head, they should sit down. Vibhu is here, he knows how it was being done. We have evolved over time. It was not that strong that time, but Vibhu was with us a long time back. But things have evolved, so we are evolving. So since this is a forum to sort of share good experiences, I'm just sharing it with you. The other thing is on the outcomes part. We are discussing about outcomes. So I think so. The clinical outcomes is something that the nurses have a major role to play. So if you look at all the things that have, so please ensure that these things are being followed. And we look at the OTs. OTs is one of the most important areas of the hospital. Many times talk about surgical site infections. There's a very important saying: events in the operating room dictate your post-operative course. वो बाहर से bug नहीं आता है. If any patient gets the infection post-surgery, it emanates from the operating room. So this is where the OT hygiene, OT discipline has to be maintained. So this is where again I appeal to all the administrators: please empower the nursing staff in the OTs, the OT managers. That discipline has to be there. The scrubbing, the gowning, then again between the tooth changeover, that 20 minutes that is there. Again, why we do that 20 minutes? Why is not many times not explained? Because you need to clean it. That deep cleaning that it takes, the contact time has, if it's there, that is the way to sterilize it. In 5 minutes, you can put the thing and then take the next patient. Non-stop. But you will not be cleaning, sterilizing your OT table, your scrub table. Yeah, and so this is a very, very important. The air changes will be over by 10-15 minutes. So that's the reason 20 minutes. So please follow this. A lot of times the surgeons, so this is where this hygiene has to be maintained. So what I'm saying is that if the processes are adhered to, and there's no better person, why I'm insisting on this. The nursing is the best way. If you can empower them, you authorize them to do this, your hospital is in a better shape. So it's very important to see that these things do take place. Again, I'll say that if you look at one of the things which have come in, patient falls. Patient falls, it happens everywhere. Some hospitals, some hospitals, we do a fall assessment. There's a checklist, they do that and all that. But this is something that I would like to put across, which we have started recently, is that whoever has done the fall assessment, the patient and the relatives know it. These are the do's, don't. File mein likh diya, bas ho gaya. But I may not, suppose I'm the staff and the nurse looking after the patient. I may have explained, I've done my duty to say that हाँ, this fall assessment ho gaya, मैं बता दिया relative को, बता दिया family members को, patient को. But has he or she understood? So that is where I think someone outside this, same, it could be a team leader, it could be another nurse, just to cross check that you are in the high risk case of fall. Were you explained? He or she will tell, हाँ, समझ गए क्या क्या करना है, क्या क्या नहीं करना है. So that's the way of validating it. So what I'm saying is that the small things do matter. The patient attendant may not be there. Although for high risk case we tell them don't leave the patient, but they may go out. Some relative has come from say Agra to see the to talk with you. You have gone down. But if they have told earlier that छोड़ के जाने time nursing station बता देना, so we are aware of it. So see small things. So the same saying that nursing is a vehicle that we have to utilize better. We often don't do it, thinking that we know everything. But my humble request is that please do this. If you do this, you will definitely benefit. Now coming to values. How do we sort of increase the value? Empowerment is one part. Again, look at your nursing manpower across your hospital. Not if someone is very good in OT care, ICU care, keep them going there. Don't make him the administrator. There'll be some who you can show them growth paths. Like we started this off now, sending some of our nursing, we have a selection, and they are not the senior ones. We take them below 40 years because that's one of the ISP requirements, TIS requirements. We're sending them from last year, the batches have started. This year again, I'm the chairman of the selection committee. Again, on 11th and 12th, I'll be in the board to select the candidates. So we are sending them to TIS, to Ministry of Business. So the reason is we want nursing leaders, as someone was mentioning earlier, to be the facility director, to be the chief operating officer, and somehow it will not be very far off when we have a nurse leader being the CEO of a healthcare company. So this thing should come from here. So if you start looking at that, then the nursing fraternity will look at, I'm just pointing to you, sir, is that Sarvodaya is a good place. They look after the nurses like they do काम करते करते हैं. There's a growth opportunities there. So these things will. So I think so across the healthcare space, this is something that we have to show. We keep talking that nursing is Florence Nightingale, the other, but काम से बात काम नहीं चलेगा ना. We have to see how we sort of put things in place. So these small things do. And the other thing is that I think so doctors, sometimes we do get upset. We blow our head. So that we should have a very low threshold for this. So if someone is, we are seeing that we are seeing it's being repeated that someone is not behaving well, then have a separate conversation quietly to sort of counsel, because everyone is good, no one is bad in life. So these small things matter. The other thing I like to see, it has not happened in India, but at least before or later, I think so they should be there, because I faced it. For the appraisal, nursing, HR. I'm not leaving you. So going forward, the appraisal जो होता है डॉक्टर लोग का, nursing feedback is also important. Why I'm saying this? The nursing feedback will give you a 360 degrees about that doctor. They may be, Dr. Gupta will be thinking, he's a बहुत अच्छा doctor है. But पर्दे के पीछे क्या होता है, that the nurses know it. So getting the feedback from them while doing the appraisal will be a very good way to take things forward. Because then what happens, you are closing the loop. Someone may be very rude with patients, with relatives, may be a very good clinician. He may be generating the highest revenue for you all. But in the long run, that is deleterious for the organization. Because finally, I'll end my talk is that nursing is at the forefront, will remain at the forefront. It's what will take care of healthcare. Between hospitals, doctors का 19-20 का फर्क होता है, not much. It is the patient experience which will matter. And if you have to enhance patient experience, empower the nurses, that is the best way to go up the healthcare ladder.
Thank you, sir, for such a wonderful speech. I would request you to stay back on stage.